This segment sponsored by Advanced Center for Pain and Rehab.
Shoulder pain is something we all experience. Whether you're 20 or 60, we all get it. Dr. Venturini is here to explain what actually happens in the body cause this pain. Take a look. Dr. Paul Venturini is back here on the couch with me to discuss shoulder pain, something that many of us, regardless of your age, deal with every day. Doc, what are some of the main things you see when it comes to shoulder pain?
Shoulder pain is very common, multiple causes of shoulder pain. The shoulder is the most mobile joint in the body, but it's the least stable. If you picture a golf ball sitting on a golf tee, that's how shallow that is. So it's good for mobility, but it's not good for stability. So the shoulder, if you think of the shoulder, most people think of one joint. There's actually 3 joints in the shoulder. There's the ball and socket, the glenohumeral joint, what we call the AC joint, and then we have the scapula that runs on your back, the shoulder blade. But it could be from tendons, so people think of rotator cuff. The rotator cuff tendons help with stability, and if we look, this is the tendons that make up the rotator cuff. There's muscles around it. So it could be from a tendon problem, it could be from a bursa, a bursitis. If you think of bursa, these fluid-filled sacs that cushion the joint. It could be from an impingement. What happens, we have these tendons that pass underneath that bone, this collarbone, and when we raise the arm, if there's dysfunction in the shoulder, it could compress that. That's called impingement. It could be degenerative arthritis. So multiple causes of shoulder pain commonly would be rotator cuff tendons and maybe bursitis. There's also because of frozen shoulder. So again,
what are some of these symptoms that people can they figure out?
So if you have shoulder problems and shoulder pain, you're gonna have pain, you're gonna have possibly weakness. When you raise your arm out from your body, reach behind, reach over to grab something, it's gonna hurt, it's gonna be painful at night. I've had experience with shoulder pain, and it's painful.
And so what are some of the treatments that you recommend people to do?
So first, when somebody comes in the office, we want to do a history, we want to do an examination where we test the shoulder, we check range of motion, we check strength in each individual rotator cuff muscle and tendon, and then we look at, okay, is it a rotator cuff problem? Is it a frozen shoulder? Is it an impingement? Is it a labral problem? So if they had trauma, we got to worry about, did they tear something? Do they have fracture? Or most commonly it's repetitive overload and then they reach and do something. So basically the first goal is to reduce their pain and inflammation. First, what's going on with them? And then we got to reduce pain and inflammation. We got to restore motion if there's lost motion. And then we got to strengthen the tissues around it.
Do you see any younger people, maybe athletes, that have a lot of this rotator cuff issues?
Yes, in an athlete, we're thinking of people throwing, quarterback, pitchers, repetitive movement of that shoulder, or if it's an athlete that's doing heavy lifting and they lift over their head or they reach out and then they feel something pop or strain the shoulder. So yeah, it's common. It's common in young and older. If you're older, you think of more of the wear and tear, and a frozen shoulder is more common in postmenopausal women. The cause is really unknown, but it's painful. The shoulders are tough, but they're tricky. But normally the good news is they usually get better and they respond to conservative treatment.
Okay, well, head over to advancedcenterforpain.com. Make your appointment if you are feeling any sort of pain in your shoulders or just anything. They're here to help. But Doc, thank you so much.
Thanks, Penny.
Thank you for watching. Make sure you subscribe to our YouTube channel and be sure to watch more segments from Marketplace on News Channel 20.